I just say whatever they write down for me. I just say whatever they write down for me. I don't know why I bring all these papers. I never look at them. I don't know why I bring all these papers. I never look at them. Why I bring all these papers. I never look at them. I just say whatever they write down for me.
That's why you're guessing.
I don't know why I bring all these papers. I never look at them.
Oh, when you're giving numbers, I do. I go, oh. I said that. Did you really say that?
I just say whatever they write down for me.
That's why you're guessing.
Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Yaffe and Dr. Williams here, so I'll turn it over to them for some brief remarks.
Right, well, good afternoon, and as being Monday, we'll look at what happened over the weekend and sort of look at what we're looking forward and what's happening this week ahead. Of course, we had some announcements starting at midnight last night, with the new areas moving into different zone colors, including 2 more into lockdown. And so I'll have some comments about that. But before I get to that, I'm going to hand things over to Dr. Yaffe, who's here with me today, to talk about the numbers and to see what's been happening over the weekend and what we are concerned about, what we have to address in the week ahead.
Okay, thank you. Thank you, Dr. Williams. Good afternoon, everyone. Hope you had a good weekend. Since we last spoke on Thursday, Ontario has reported an additional 7,338 cases of COVID-19. The 7-day average is now 1,841. This is up from 1,820 a week ago and 1,570 cases 2 weeks ago. Most recent number is 1,940 cases. The majority of cases reported since Thursday, approximately 59% of the cases since Thursday, are in the regions that are now in red or lockdown levels. When broken down even further, about 16% of cases since Thursday are in Toronto, Peel, and York. We've also seen a consistently high number of tests being processed. On Saturday, we had a record high, 65,260 tests were reported. And on Sunday, it was down a bit to 58,190. Today, that number is 57,091 tests. But that drop is something we do typically see at the beginning of each week. And our percent positive today is 4.6%, which is up, but our percent positivity over the last few days has averaged 3.5%. Today we have 857 people in hospital in Ontario with COVID-19, up from 725 a week ago, 618 2 weeks ago. We now have 244 patients in the ICU, which again is up from 213 last Monday and 168 2 weeks ago. Sadly, since last Thursday, we have seen another 101 people have lost their lives to COVID-19. I'm going to now turn it over to Dr. Williams for some further comments.
So with those numbers, and they keep getting adjusted each day, the record amount of testing over the weekend and the amount of positivity from the testing that's sort of in the queue coming up would not surprise me if we went over 2,000 cases in a day, which we have not breached so far. We might see that early in this week here. So that is concerning. And the numbers in the intensive care, well, the numbers that Dr. Yaffe had alluded to, it's projecting that some of those are going up even further, getting close to where we were as a maximum in wave 1. So we have this issue that we talked about with Dr. Brown on Thursday, with the projected numbers being somewhere between 1% increase week over week, going up to 1.303. So we have to be worried about that 1%, 3% growth, as he said then, and we're on this sort of tenuous area. And as the numbers are not coming down, as we set back to, again, 1,940, second highest, I should say, we've seen in a while, that's not really good over a weekend. So we're concerned where this might go in the days ahead, especially as we head into the holiday season and what we might have to feel and deal with. We did move up, as you heard in the announcements, some areas such as London, Simcoe, and Wellington to the red zone, even Leeds, Grenville from green to yellow. And then we added Windsor and York to Toronto and Peel in the lockdown phase, or the gray zone in there, seeking to try and keep these numbers under control. And if we can bring them down at all, as we're seeing start to have effects on the healthcare system, as Dr. Yaffe had mentioned, and how that needs to be really concerned about as they start to cancel in some areas elective surgery, and they have ramifications into wider outer areas, because some of these centers are also tertiary centers that take referrals from other ones out in the region. So it's a really important time to really focus now on saying, what do we need to do to keep these numbers under control and to reduce them if possible. But on the other side, we did have today, you saw the launch of our first number of vaccines here in Ontario. We did receive some last night, earlier today, I should say. And as you saw at the University Health Network, they did the first person and the first 4 or 5, because you open up one vial, you want to do 5 people. And we're going to be starting to see some more at Ottawa tomorrow, and over the week progressing through, not like running out the door doing everybody all of a sudden. We want to make sure we use our 3,000, basically 6,000, divided in 2 groups for the first dose, and then the other one following up later, effectively, carefully, and carried out in each of the centers, and then using that as a process to see how did we do, how much can we do better, and then to make sure our next arrangement of sites that General Hillier is alluding to, that they're ready to go when the vaccines come, and we're ready to go. So we want it steady, solid, and consistently done throughout our whole process. And so you saw some of that launch. So that gives you that sense of the start of that process. It's just the start. And that's the thing, is that while we go through this and get vaccines coming in, both the Pfizer, we're waiting for the next one, the Moderna, to get approved by Health Canada and start to flow as well. We have a lot of work ahead of us. But at the same time, that means we have to be consistent in how we're going to get these numbers under control. Our cases are still occurring. They're occurring in more places outside of our main ones of Toronto, York, Peel, and parts around the GTA. They're moving into other areas further out. And they're going from green to yellow, yellow to orange, and orange to red. So the type of risky behavior seems to be continually occurring throughout Ontario, with people being more and more casual with those personal contacts, those social contacts in their lives, and going out and around. So we really want to bring that back and say, you have to really stick to the plan, because it is in our hands to deal with. We can, as we did back in March and April, we brought it under control. We brought down that first wave with very strict controls and limiting ourselves on going out, this household, not doing things that are non-essential. So can we get back, and can we do that? Can we contain it by social distancing, wearing a mask, hand hygiene, staying home if you're ill, getting tested if you need to get tested, and all the things that we have did before? We seem to have difficulty, some of the people, difficulty in getting back to that. That's where we're having record numbers of testing, 66,000 in one day. That's a new record for us. And as Dr. Yaffe said, with even 58,000% positivity rate of over 4%. And that really spells trouble and issues for us. So a bit of a mixed message as we come in here. We're getting ready for the holiday season, but it's not a regular holiday season. It's a COVID holiday season. And how can one do that? Because if we don't do it well, then the repercussions are there with our healthcare system, impacting upon our school systems and our long-term care facilities, with more and more people showing up positive, getting it from high community transmission. So in one sense, optimism with the vaccine coming. But that's a long road. That will not happen suddenly in January and February. It's going to be phasing through. We're going to stick to our priority groups, making sure those that are most prone to getting either contracting disease, that are in key positions of healthcare or are involved in care with long-term care, are going to be around that to wall off and protect those vulnerable people as soon as we can, as quickly as we can, under the guidance and direction of our task force led by General Hillier in that. So keep tuned to that. We'll give you updates as frequently as we can on that process as we roll it out through other parts of Ontario in the near future when General Hillier is going to make those announcements, and we'll be following along with that. But we have to be stringent. We have to be vigilant. We have to stick to our task, because even as that's happening, our numbers are going up. Our healthcare system is being threatened by more and more people, because those big numbers every day, 1,900, maybe 2,000 or more, as we said last week on Thursday, that starts to back into the intensive care system, which backs into the hospital system, which starts to then cause delays or cancellation of elective surgery in that process. So we have to do our part, even if you may say, well, I'm under the age of whatever. I don't have to be, but that has impact if you give it to others, which gives it to the vulnerable, which ends up being in the hospital with the % positive rates there. And we're not the only province dealing with this issue. Others are struggling with the same matters. So stay consistent, stay vigilant, do what you need to do, and we're going to have to work hard to get these numbers back down again, especially as we enter the holiday season here. It's going to be a different COVID season, and we're going to have to do everything, do it well, and do it again, and take measures to bring it under control. So with that, I'm going to hand things over to the media for questions. Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Randy Rath with CHCH TV. Please go ahead.
Hi, doctors. Hamilton has been in a red zone for a couple of weeks, and their numbers, while they do go down occasionally, seem to be steadily going upwards. Even with enhanced red zone protections down there, it doesn't seem to be getting under control, and a lot of people are wondering why it wasn't moved into the gray zone on Friday. Are you guys looking at that, and are you considering moving Hamilton into the gray zone?
Yeah, thank you for that question. All the ones in the red, we continue to look at to say, are they going into the gray zone? So we were looking at that. We could see, as you said, it sort of went up, then came down again. It seemed to be holding a bit, but then seemed to be picking up. Other ones that are in the same category that we've been worried about, we were worried about Windsor, Essex, that was moved into red, and we saw that one really blow past the other ones, even Toronto with its numbers, so we moved them into the gray zone to lockdown. So we are reviewing numbers. Even today we'll be looking at numbers again as we go through the process every week of doing that, and I agree with the concerns of what's happening, and we monitor it very carefully and discuss it with the MOH there, Dr. Richardson, and to see what recommendations and how they're seeing things, and then what we can do. So it's not just Hamilton, there's some of the other ones in the red zone that are concerning also, but as I said before, there's concerns with ones in yellow going to orange and orange and going to red. It's just that shifting is not encouraging, and we're going to have to see what we can do to keep it under control.
Follow-up?
Yeah, there's a long-term care home in Hamilton, Grace Villa, which is having some real problems with an outbreak. They've had 173 cases since November 26th, and the nurses union has asked for the Army to be called in to help them out with their struggles with COVID. Are you considering calling the Army in to help out homes that are in outbreak now?
So, I mean, whether Dr. Yaffe wants to make a comment because she's with the IMS group, we did use the Army in the first time because we didn't have all our other structures set up with Ontario Health. We have processes in place where we've been using the acute care hospitals to assist if and when necessary to bring them in. So we have that process in place, which we didn't have. We were just starting to get some things going in the first wave. It came on very quickly, and so that extra help did come in. I think this time of course, we have a number of places around the province where we're already using that, and perhaps Dr. Yaffe want to comment on how that process with the long-term care IMS is working this time, and the need or no need for the military at this time.
Yeah, the long-term care IMS group, Incident Management System, it meets 3 times a week, and it goes through in great detail specific long-term care homes that are having an outbreak or even look like they could be heading into an outbreak, and trying to act proactively to control and prevent and further spread. And we bring in a hospital, link it with a hospital for extra support, and we also link it with what we call hubs for infection prevention and control to have increased support in that way. So I would have to see what the group has discussed around Grace Villa, but we're aware of that outbreak, and it's always infection prevention and control and health and human resources that are the biggest issues in these situations. So those are the ones we are always working to address. I don't think we're looking at the Army at this point, but we have to look at what's needed to be done.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Dr. Williams. Just thinking back to your introductory remarks about the way cases aren't going down. So we've had Toronto appeal on lockdown 3 weeks, Windsor and York going into lockdown today. We keep hearing this message from you that people are being too casual, and yet you still seem to be waiting for things to get worse before you elevate the color level of some of these other health units you're talking about where it keeps getting worse. I'm wondering, is this strategy actually working? Because you talk about this over and over again, and then it gets worse, and then you have to do something. Why are you not being more proactive?
So, that's a good question, Rob. If you, one reason we did put out the framework and we did make it public because the public can see the numbers there. So for us to say, well, even though the framework says we should go from yellow to orange, we're just going to jump it right to gray. People would say, well, wait a minute, that didn't add up. And so there's a process we're trying to walk through, and we're trying to ascertain whether the framework, as it keeps ramping up and closing down more and more activities, is that giving enough alert and a wet message to the public in those zones saying, yeah, I guess we're not doing so well. I guess we got to do better and better if we're going to get out of it. And people often ask that question, if you're in a lockdown, a red zone, how do we get out and open up more up? And the answer is, it's obvious, get back into orange and yellow and green before you can do it. And that's really mostly to the public. We're finding that a lot of the outbreaks that we're seeing are basically those ones cascading into our long-term care, schools, and other settings. There are some workplace outbreaks. So I think the question you're asking, if you look at Peel and Toronto in their third week, where they were supposed to be projecting on their original rise to be somewhere now between 800 to 900 cases a day in each of their respective jurisdictions, they have sort of leveled and plateaued. So in that sense, both Doctors Lowe and DeVillo feel that the lockdown has had some effect. Has it brought it down? The answer is not really. It's leveled it off, so we've stopped it from going up to 900 to 1,000 cases a day, which I guess is one good thing. We would have liked to see it even coming down even stronger at this time in those areas. So it asks the question if the framework has to be addressed in that sense to get in some better action that would bring the larger part of the public back into adherence towards the social distancing, the household numbers, all those aspects we've talked about. We're asking that question of how we might have to deal with that. So we're sticking to the framework because we put that out to the public. It's what we said we would offer, and it means the public can deal with that and try to assess and adjust their personal behavior to say, well, I guess we haven't been so stringent. I guess we now need to pull back down and become very rigid on how we're going to apply this in the next number of weeks, especially, which in the holiday season will be challenging. But I think we're going to have to do that and to see how we can make that occur. So I agree with your point. We have the framework out there. We're trying to adhere to it because it's what the public use to measure themselves. But then you have to back that into personal behavior saying, yeah, I know we moved into red and my behavior is basically very casual. I guess I'm going to have to get back and focused again. So that's why we have to ask people, refocus, recommit, and be vigilant in your activities.
Follow-up?
Okay, thanks, Doctor. Just to clarify a bit of that, are you thinking of maybe tightening the criteria in those frameworks? Is that what I heard you say? And just as a add-on to that, where are we in this whole process? Like, if we expect people to be done, if we expect the vaccinations to be finished in the fall, so are we kind of like halfway there to beating this now?
Where are we? Well, we would like to have been at the top of the second wave and coming down. We're still hanging in there at this plateau at the top here. As Dr. Brown was alluding to, we're between 1,821 cases a day. So it's like, say, oh, well, at least we're not going up to 5,000 or 6,000. That's not much consolation. We want to see that number, if we're going down the other side, to start like it did in the first wave, start coming down steadily down the other side. Remember, it didn't come down very rapidly. It peaked in about the third and fourth week in April, and we started coming down in May and June until we dropped down in July and August. So we have a long way to go and get down there, and especially if you're waiting for the vaccine to come out and the other products to get up to a large percentage of the population vaccinated. As you alluded to, that's not until later in the late spring into the summer until we get into that kind of process, all things being considered, all vaccines coming out in a timely fashion. So our work right now is to do our public health measures and to get that number down so we can start coming down the second wave in the slope there. So we got that's right ahead of us right now, because right now our healthcare system is being stressed, and we've got to do it and do it stringently. So we'll have to look at that and see how certainly we have to address that matter.
Next question.
Your next question comes from Colin DeMello with CTV News. Please go ahead.
Hi, good afternoon, doctors. I'm just wondering about, the arrival of the vaccine and your concerns about what that might do to the general compliance, because a lot of people are probably looking at this vaccine and mentally thinking, wow, it's almost over, it's almost done. How concerned are you that people will look at this and say, I can stop adhering to the rules now because the vaccine is here?
I think it's a good point. I'd like to say, because some people are getting into COVID fatigue. It's like, this is just going to go on forever. But now with the vaccine ahead of us, it's like you can start to see on the marathon the finish line coming. So you get that renewed energy to really focus back down again, saying, okay, so I don't have to keep doing this kind of thing for the next 2 or 3 years. I can see that there's a potential end in sight. But we need to get that back down again. So, one of the things, if you're really ill with COVID, you can't get vaccinated at the time. So you're going to have to, we'd rather not do it when you're sick. So therefore, then I would see it as a chance to say, okay, we can see this, we can get there, we can do this. Let's refocus and get this back down again, because it's better to be vaccinated when we don't have massive outbreaks everywhere. We need to come down off the second wave, and so we can enter the vaccination phase full tilt in a low incidence prevalence rate. And that's what we need to do. So I would hope it would be the opposite, that people would see the need to get back to the task of sticking stringently to all the criteria, the public measures that have to be with us very strong and consistently now until at least now May or June, before we can actually get a lot of vaccine program rollouts.
Maybe I could just
Sure.
add to that. I think the studies have shown that the vaccine is very effective in preventing disease and preventing people from becoming ill or seriously ill. They haven't yet been able to show whether it prevents infection. So even if somebody gets vaccinated, they may have an asymptomatic infection. So they could still be infectious to others. We're still going to learn, and it may be that is not the case, but currently we don't have that evidence. So even when somebody's vaccinated, they need to protect themselves and others from spreading the infection. So, and of course, as Dr. Williams said, it's going to take months before we end up with a significant percentage of the population vaccinated. Usually for infectious diseases, we're looking 70–80% of the population has to be vaccinated for what we call herd immunity. We're not going to get there with this vaccine until probably the summer. We're off to a great start. We have a very good vaccine, and we're going to be vaccinating those most at risk of severe illness and those who take care of them. So we're going to prevent serious illness and death. But we're not going to prevent the spread of the infection in the general population until we hit herd immunity. So it's very important people continue to do the basic measures.
Follow-up?
Thank you for that. And so if I could follow up on that, when do you think it would make the most sense to start using these vaccines on the general public? I get that there are many classifications that we want to get through, and it seems like the general public is kind of last in line rather than being kind of in the middle. It's, long-term care, healthcare workers, northern areas, remote communities first. At what point do you feel like we should be focusing on just the general public who have the most contacts going to work and school and therefore are at most risk of spreading the virus?
Well, our plan, and I know General Hillier's plan, is when we get the vaccine, we're going to do everybody as soon as we can. And that's the whole idea. So it's the supply issue. And we have from the Pfizer product, and we're waiting for the licensing of the release with Health Canada of the Moderna. And then we have some more coming. So we need all these companies that are working at full tilt to get all their proper steps for their approvals ready to go to Health Canada, and then the volumes. So our challenge is that we need the volume of vaccine coming in. And as soon as we have it, we plan to vaccinate, and it's just a staged process. It's not that we're going to say we're going to leave the public out to the end. If we have the vaccine sooner, we'll go out sooner. And that's true. So we want to make sure we use the vaccine the most effective, efficient way. We're following the National Advisory Committee on Immunization Guidelines, consistent with our Health Canada and FAC directives and with other provinces. So we do our priority populations first. They'll have the best impact. And if the vaccine comes in quicker and sooner, we'll be doing more and more sooner and quicker. And so it's mostly a supply issue right at this time and how fast we move. And that's why we're going to be using our task force with General Hillier. We'll be updating us on as soon as we have it. We're doing it.
Last question.
Your last question comes from Joanna Furcadic with Hamilton Spectator. Please go ahead.
Hi, thanks so much for taking my questions. I'm looking to find out if you can give me an idea of when Hamilton will see its first vaccines. Like, are we talking days or weeks? I know they're going to some priority areas first.
So the plan is that we have already working through selected sites how we're going to roll it out, mostly because we're dealing with the Pfizer product at this time. That means we have that limitation that has to have the ultra low freezer, and then we have to do the vaccinations out of that site because we do not want to physically move it around extensively after that. So we're going to try and look at those sites. As I said, we're going to use the UHN and the Ottawa this week to make sure we look at all the logistic issues that need to be dealt with. So it's a process that each one can emulate and roll it out around the province. And then the big thing is that when are we going to get the next stock and the next load and stock of product from Pfizer, and it has dates that are laid out presumptively. We want to know when we have it. So we want to make sure that we're doing that. So that's going to be rolled out across the province in different areas. Again, dealing with the priority populations, similar to what you have seen at UHN and Ottawa in each of the respective jurisdictions. And in that, so I'm sure the centre like Hamilton will be one of the next ones on that next group of cadre of sites that are going to be picked, because we're going to make sure we go to all the ones that have a lot of activity. We're trying to get the gray zones, the lockdowns, and the red zones and rolling out. And then, of course, we're waiting for the Moderna to come out, which has a different type of issue around its storage. And it can be used much more with the larger transportation out and deal with our highest populations, having discussions with our First Nation leaders on how we might make sure that they're covered in those areas that have great risk if it breaks out in their more rural and remote areas. So there's a number of phases in here that the task force is going to be addressing, again, depending on when things are released and when we get our stock and supply coming into the province of Ontario.
Follow up, and this is the last question.
Hamilton has multiple outbreaks in long-term care homes, including the one with 173 cases at Grace Villa. It's being called like a war zone here, and we see new ones every single week. Why do these homes not seem to be prepared for the second wave? And, what is being done to prevent this from continuing to happen?
Okay, Dr. Yaffe, would you like to answer that?
Well, as we know, these are very high vulnerable populations, high-risk vulnerable populations. And some of the homes, I'm not sure about the specific ones in Hamilton, but in general, some of the homes are older buildings. They have more crowding than would be ideal. They may have 3 or 4 bed rooms, which are not ideal for infection control. And they may have issues with staffing, chronic issues. In terms of infection prevention and control, we have known this is an issue, and we have created what we call hubs, usually in hospitals, sometime in health units, can provide extra support on infection prevention and control to the settings. But sometimes it's actually the physical layout, and that is very difficult to deal with. And so it's an ongoing issue, and that's why we are working so hard at our incident management system and working very hard with the hospitals, supporting those homes as best as possible, because it is a difficult situation.
Thanks, everyone.